Chapter 9. What is a SOAP note? SOAP notes for physical assessment. The SOAP note includes the subjective information from the patient. The introductory statement summarizes the patient's description and chief complaint and fleshes out the components of the problem. Throughout the ages, the acronym OLDCARTS has been used as a guide for the most important questions to ask during an examination. The objective portion of the SOAP note is made up of objective data. Listed below are some tips to help you develop a SOAP note. Objective data. The objective data for SOAP physical assessment consists of several sections, each with a particular goal. First, the SOAP note should be based on a system and should reflect changes in the S and O of the patient over time, as well as changes in treatment or interim events. Second, the SOAP note should include a list of issues that the patient may have, along with their differential diagnosis and planned treatment. The SOAP note is a medical record that allows healthcare professionals to make diagnoses and assess their patients. These notes contain subjective sections and objective data collected through physical means. In addition to the subjective section, SOAP notes also contain a section on the patient's lab tests, blood work, imaging, and diagnostics data. The assessment section includes the health professional's opinion. In addition, the note should document the patient's response to therapy. The SOAP format is an essential form of communication between healthcare providers. It provides concise documentation of observations, data collected, and actions taken. The SOAP notes ensure proper credit for hard work. A few examples are listed below. However, the goal of SOAP notes is to capture the most important information and not waste time describing the least important. SOAP notes also make it easier to read and scan documents. The use of standardized templates is also helpful for the standardization of the SOAP process and assessment methodology. The SOAP note has two primary purposes: to document the healthcare encounter and to provide written proof of observations. First, it allows the healthcare provider to record data that they might not have gathered based on their observations. Second, it provides written evidence of the patient's condition. Finally, the SOAP note helps the healthcare provider determine the patient's needs and make the necessary changes. For both purposes, a SOAP note is useful and should be a valuable tool in the healthcare profession. Subjective assessment. A SOAP note consists of the S and O components of the SOAP acronym. It should reflect the patient's change in the S and O over time as well as the response to any therapies and interim events. And SOAP notes should be updated regularly to accurately portray the patient's current condition and any changes that may occur. During the course of the SOAP note, other information may be gathered such as the patient's risk factors, laboratory and radiology results, or outside consultation reports. The patient's physical assessment notes should follow the SOAP framework, which describes the steps in a healthcare visit. During the subjective portion of the documentation, the patient should describe his or her symptoms and current feelings. This section should be written in the patient's own words, so it is essential to ensure the accuracy of the notes. Using quotation marks for direct quotes is also important. When writing notes, always make sure to include your patient's name, address, and insurance information. The SOAP note is a useful method for documenting medical encounters. It streamlines medical professionals' note-taking by creating a system that stores client information in an organized fashion. The acronym stands for the four components of a SOAP note: subjective, objective, assessment, and plan. The SOAP note structure was originally developed by Larry Weed, an American physician, researcher, educator, and author. He used the SOAP note to track progress and evaluate a patient's condition. The SOAP note begins with the subjective part, which includes subjective information that cannot be quantified. The next section focuses on the assessment process, which entails the diagnosis, the plan, and any additional tests that are needed. If the physician believes that the patient has a medical condition that needs to be treated, he will detail the findings in this section of the SOAP note. There are other parts of the SOAP note that may need further testing. Most likely diagnosis. The most likely diagnosis of SOAP physical assessment note should include a differential diagnosis, active problems, the most likely diagnosis, and a less likely diagnosis. The diagnosis section should include evidence supporting the diagnosis, the patient's current status, the likelihood of improvement, and any complicating factors. The SOAP note should also explain the importance of the patient's treatment plan. If the diagnosis is not clear, it is essential to discuss the patient's symptoms and history to guide treatment. The subjective part of the SOAP note contains information provided by the patient, such as the chief complaint or description. The SOAP note should be continually updated to reflect changes in the patient's condition over time. It should also include important risk factors, medication information, laboratory results, and outside consultation reports. During the SOAP note, the student must consider the most likely diagnosis and explain why. This section should be concise and informative. A SOAP note is a form of medical note that records information from a patient's medical encounter. The information can come from the patient, a family member or friend, or from a study or database. The purpose of SOAP notes is to gather accurate information about the patient so that treatment and diagnosis can be effective. Plan and prognosis. The S and O components of a SOAP should be described in the notes. The diagnosis should be listed in descending order, starting with the most likely. Then, follow up with a list of possibilities that may not be as likely. Finally, the plan portion of the SOAP note should describe therapy and recommended tests and treatments. Finally, the patient's condition and risk factors must be discussed. Notes from SOAP sessions should explain what the therapist did during the visit and how they managed it. For instance, if the patient has several major diagnoses, they should list each one. They should also specify whether they are stable or not. In addition, the notes should contain the differential diagnosis, or list 2 or 3 possible diagnoses. The SOAP note should also include the patient's next appointment and any homework that was given. Notes from SOAPs are structured to increase the accuracy of the notes. They provide a systematic method for gathering all the information needed for proper diagnosis and treatment. The notes are organized to support the goal of providing the most effective care for the patient. In addition, SOAP notes focus on the assessment, plan, and history of efficacy. They also provide a foundation for consultation with other care team members.